Welcome back, listeners, to another episode of Susan Lopresti Wellness, Mind, Body, and Soul, the podcast where we explore the highs, the lows, and everything in between when it comes to a woman's life, her health, and all aspects of navigating the midlife landscape. I'm your host, Susan Lopresti, and today I decided that I wanted to talk about, and it seems like a no-brainer at this point in time, but yet I felt it was important enough to bring this topic to my podcast, and that is the importance of regular dental hygiene. So I don't know about you, but I believe that it's something that really goes unnoticed in our very busy lives, but it's incredibly important for our overall well-being and regular dental hygiene. That's the bottom line, right? And when I was very young, I remember going to the dentist. I was somewhere between the ages of, let's say, 9 and 12 that I went to the dentist for the very first time. So obviously my parents weren't in the know about the importance of dental hygiene back then. And actually I know that for a fact because my dad, when he turned 50, he had no teeth in his mouth. He was getting dentures at 50 years old. So back then, I really don't think that they did much as far as dental hygiene. Maybe they couldn't afford it. I don't know what it was, but I know that the first time that I actually was at the dentist, I had 13 cavities. And back then, this was in the 60s, we didn't get a gel or Novocaine or numbing gel like you get today, or gas. I don't remember ever doing that. We went without anything, and the drills back then are not like the drills that they have today. It was like a jackhammer drilling into your head. It was such a painful experience, but it was traumatizing as well, right? And needless to say, that it left me petrified of ever going to the dentist again. And in my younger years, I would stay away from the dentist for years at a time. And I remember I was in my very early 30s and I found myself with bleeding and swollen gums. They were very inflamed, and I knew that I couldn't hold out any longer. And I had to go to the dentist. I just had to go. And sure enough, when I did finally push myself to go to the dentist, I had the worst case of periodontal disease that I had to see a periodontist. And I actually had two surgeries, two different times to correct my gum. And you know what it is that your gums are adhered to your teeth, right? And it keeps them in place and it keeps them healthy. But in my case, my gums were so inflamed and so diseased that they were pulling away from my teeth. They weren't loose enough that I could feel my teeth, but my dentist told me that if I didn't go, sooner or later, I would end up losing my teeth. And it was my front teeth as well. So I had pockets, and these pockets had created bacteria. And the surgeries were not so bad, they really weren't, because I was completely numb. And then I would get Novocaine, and they also gave me gas because they knew that I was paranoid of the dentist. Obviously, that's why my teeth were in the condition that they were in, right? But now, as an adult and have been through bridges and root canals and teeth pulling and implants, you name it, I've had it done. I've probably spent over 100 grand on my teeth or more at this point in my life. And it was an ordeal. It really was. But truthfully, though, compared to the ordeal of seeing a dentist in the 60s, when you go to the dentist today, they truly are painless. There's nothing really that you need to fear because they make it so easy for you, and the equipment is so high tech, and the dentists are so advanced today than they were back then. So if you have fear, take it from me, the biggest chicken shit out there as far as the dentist goes. Today, going to the dentist is like a walk in the park, right? And we all know the basics. We know that brushing our teeth at least twice a day, flossing, and visiting the dentist regularly is going to give you the best possible results for having a healthy mouth. But have you ever stopped to think about why these habits are so crucial? So I want to talk about, because it's not just about oral health. Oral health is directly connected to overall health of the body. And that's what I want to come on and talk to you about today. I really don't want to scare you about the dentist, because these days, there's nothing to be scared about. I just wanted to give you a comparison of how it was back in the 60s, and how, I'm not going to say all parents, I can only speak for my own parents. Obviously, they didn't take oral hygiene very seriously if they waited for me to have 13 cavities in my mouth before they actually took me to the dentist. So you know that I had to be about 9 years old. I can't say for sure, but I was somewhere in that age range. 8, 9, maybe 10 years old. I'm not quite sure. It was a traumatic experience for me. So let's go on to talk about how important your oral health is. So our mouth is the gateway to the rest of our body. And oral health is not just about having a bright smile or fresh breath, though those are definitely nice perks of having good oral hygiene. But regular dental hygiene plays a vital role in preventing a host of health issues that could extend far beyond the mouth. And that's what I want to talk about today. So when we neglect our dental hygiene, plaque buildup can lead to gum disease, which was what I had full blown because I needed to have surgery 2 times on my gums to get them back to health. They were cutting them, they were stitching them, making them tighter around my teeth. I mean, I'm talking that I feel like I'm lucky to still have my teeth, because I was in my early 30s. If I had waited any longer, I'm sure they would have been extracting teeth like crazy. So this is not just a localized problem, right? Research has shown that gum disease can increase the risk of serious health issues, such as heart disease, stroke, diabetes, and even respiratory problems. Now, I do have a very mild respiratory condition. And when I did find out about it, and I was asking, why do you think I have this condition? And I was told, if you had pneumonia, which I did, it could have been from that. Or if I had periodontal disease, it could be from that. So because I had both, I'm not really sure why I ended up with a lung condition. Very mild, by the way, but I have one. So what happens is the bacteria that's in our mouth can enter into our bloodstream, and it can affect other parts of the body, which will lead to, anytime there's an infection in the body, there's inflammation. And also, if not addressed, other complications will start to arise. And we don't want to wait until that happens to make a correction. So, of course, prevention is better than the cure, right? And that's what I always say. The old adage is prevention is better than the cure. And this holds so true when it comes to dental hygiene. Regular brushing and flossing every day. Food particles that get caught between the teeth. You may not even know that they're there. Over time, that builds up into plaque. And plaque is a very sticky film of bacteria that forms on our teeth. And if plaque is not removed, it becomes hardened and it turns into tartar, which can only be removed at that point by a dental professional. That's why I see my dental hygienist 4 times a year. I have to at this point because of what I did to my gums, or what I didn't do for my gums, I should say, back in my early years. There was probably a 10 or 15-year span by the time I went to my dentist in my early 30s. There had to be 10 to 15 years of no dental hygiene whatsoever. I'm not proud of it. I'm just letting you know that it almost cost me my teeth. So by maintaining regular dental hygiene routine, we can really prevent common dental problems like a cavity, gum disease, and bad breath. Guess what? I haven't had a cavity in years. I haven't had a cavity in years because I go for a cleaning every 4 months. So I don't have cavities. I don't have gum disease. And hopefully most days I don't have bad breath because my oral hygiene routine is so regimented at this point. And I will also, and it'll be a topic for another day, and I probably already talked about it here on my podcast, but there's a whole Ayurveda routine that dates back 3,000 years of oral hygiene. And I practice that as well, right? So we'll talk about that another time. But these issues that I'm talking about, if left untreated, like cavities or gum disease or bad breath, even bad breath, that's a clue that something's not right in your body. These issues left untreated could lead to more serious complications such as tooth loss, infections, and the need for costly dental treatments. Now, I don't want to scare you, but I had a friend of mine who had a significant other. I don't think they were married, but they were in a relationship. And when I met her, she was telling me that her significant other was in the hospital with a very serious infection because of a toothache that he left untreated. And the infection went to his brain. And not to scare you, but he did end up dying because of it. So I'm talking that it's a serious thing, and maybe not death, but infections left untreated can have a detrimental impact on your health. I want to say that again, but not only on your health, also on your pocketbook, because it can get extremely expensive with oral hygiene and seeing a dentist. And even if you have dental insurance, they don't always cover a lot. And there's a cap on what they pay out per year. I know all this because I've been through it all. And I have to say that probably out of pocket, I've spent close to $100,000 on dental treatments over the years. I'm not a youngster anymore, so I've been going to the dentist regularly from my early 30s, and now I'm 64 years old. So 30 years, basically. If I was to add it up, I would guess more than $100,000. I've borrowed against my 401k at times to pay for treatment. So I know, and then I had to pay myself back. So it's very expensive. So my advice is to go regularly. Now, I go 4 times a year. And when I did have dental insurance, my insurance would pick it up because I have a history of periodontal disease. So they pay for prevention, right? Because it's a lot cheaper to pay for cleaning than it is to pay for oral surgery. So the insurance company, if you do have dental insurance, most will pay and cover 100% of the cleanings. And that's great. And I think also once a year for x-rays as well. So because at one point I was so deathly afraid to go to the dentist, and I waited so long until my gums were bleeding and swollen and inflamed, like I said, it cost me thousands of dollars for periodontal surgery. And these days, it doesn't have to be like that. And now the next reason to have good dental hygiene is for confidence and also the quality of your life. So what do I mean by that? Well, a healthy smile can boost our confidence, right? If you have really bad teeth and they're rotted and your gums are inflamed, you probably don't want to flash a smile to a lot of people. But when you have a beautiful smile and your teeth look healthy, and I don't say they have to be pearly white, but when they're healthy and you know that you're taking good care of your teeth, you have more confidence. You'll flash that smile. And this just helps to enhance the quality of our life. Believe it or not, you may not think so, but when you smile, your brain is being told that you're happy, right? A smile means happiness. So the more you smile, the more happy you will be. And when our teeth and our gums are healthy, we feel more comfortable in social situations. You may not realize it subconsciously, or you may be holding back. So with a beautiful smile, you're less self-conscious about your appearance, and you can enjoy a wider range of foods also without discomfort, right? If you have cavities that you're not addressing, everything like hot and cold, you're going to experience pain. If you start experiencing any kind of pain from drinking hot coffee or cold drinks, either one, you need to get to the dentist. So you want to be able to eat and drink without any kind of pain at all. Poor dental hygiene, on the other hand, leads to bad breath. It leads to tooth decay, gum disease, all of which are going to impact your self-esteem and make us hesitant to smile, to speak, and to interact with others. You ever see someone who smiles and they cover their mouth, right? They're embarrassed to show their smile, their teeth, but your smile is what lights you up. Your eyes change, your eyes sparkle. If you have a beautiful smile, your whole face lights up. So also, you want to set a good example by having good hygiene. So for those of us who are parents and caregivers, maintaining good dental hygiene is about setting good examples for the next generation. And unfortunately, not to throw my parents under the bus, but obviously, if they weren't taking me and my brother to the dentist at an early age, they weren't going to the dentist either. And like I mentioned earlier as well, my dad had no teeth in his mouth at 50 years old. He was wearing dentures. So it just wasn't either known or important back in the 60s as it is today. And I'm sure they know a lot more today than they did back then, as far as that good dental hygiene leads to overall health in your body. They probably back then never made that connection, right? So teaching our children the importance of brushing and flossing from a young age helps to instill these lifelong habits that will benefit them for years to come. And I know that when my daughter was growing up, and from a very young age, from when she first started cutting baby teeth, we had a baby toothbrush and we went in the bathroom and we brushed our teeth morning, noon, and night together. Right after lunch, we would brush. And it was just a way of instilling a positive habit that she learned from very early on. And also, she's 31 years old. We just went for a cleaning the other day, the two of us together, and she doesn't have any cavities. She's never had a cavity. So I take credit for that because I instilled in her from a young age to brush, to floss, and that's what she does, and she has no cavities. At 9 or 10 years old, I had 13 cavities. Do you see the difference? So I want to give you some practical tips for maintaining dental hygiene. What can we do? What can we do to ensure dental hygiene is up to par? So here are just a few practical tips that you already probably know, but I'm going to remind you of. You need to brush your teeth at least twice a day. Now, there's two schools of thoughts as far as toothpaste goes, and I want you to do your own research. Fluoride toothpaste will help with preventing cavities. Do your research on fluoride, though, because if you have any kind of a thyroid condition, fluoride attacks your thyroid. So I do not use fluoride toothpaste because I have Hashimoto's disease. The advice that you would get conventionally from a dentist would be to use fluoride toothpaste. If you're concerned about thyroid health or health in general, just do your research on fluoride and then make your own informed decision about it, right? Most experts will say to use a soft bristled toothbrush, but whatever feels most comfortable to you. But if you're using a very hard bristle brush, go gently around your gums because you don't want to irritate them in any way. But a softer bristle, you could go more towards your gums and really get in there. So that's my only advice with that. And make sure that you brush for at least 2 minutes, covering all surfaces of your teeth. So that's the outside of your teeth. Brush inside of your teeth. Brush the bottoms all the way around and also inside. You want to go all 4 sides because where it's hard to get in between and where you struggle a little bit more, those are the spots that will get periodontal disease before other spots because they're hard to get to. So you want to be sure that you're spending some time in those hard to reach places so that you don't have that issue, right? And then flossing daily, at least daily. I floss after every meal. I always have floss in my pocketbook and I'll go into the bathroom, either home or a ladies' room in a restaurant, and I'll floss. Flossing removes food particles and plaque from between your teeth, which you're not going to see right away, and then it's going to build up. So if you floss once or twice a day after meals, that's what I say, floss after meals. You get under the gum line where your toothbrush can't reach. And if you're not flossing, that's where you're going to end up with periodontal disease. Anywhere that you can't get with a toothbrush, you need to use floss. Also, a water pick is a great tool to have. And, you know, they used to have the bigger ones that were a little bit more cumbersome, but now they have water picks that are like a bigger toothbrush, more or less, and they work just as well. The next thing I want to tell you is to use mouthwash. Now, mouthwash can help to reduce plaque. It can help prevent gum disease and freshen your breath. The other thing I want to say about mouthwash is to also do some research, because there's a tricky fine line with mouthwash, because mouthwash kills the bacteria that causes bad breath, but mouthwash doesn't know the difference between good bacteria in your mouth, which we all need, and killing the bad bacteria. So I will do another episode talking about oil pulling. And oil pulling is one way that you could replace mouthwash. I'm more holistic, so I truly don't believe in conventional mouthwash, because our mouth is filled with bacteria, right? And when we have more good bacteria to bad bacteria, that's called symbiosis. And it's supposed to be like that. But if you're using mouthwash, like I said, it doesn't know the difference between the good and the bad. So it kills both. And when that happens, then you are in dysbiosis. And dysbiosis is the unhealthy is overshadowing the good bacteria. And you don't want that, because that's what's going to lead to cavities and periodontal disease and so on and so forth. So do some research about that, and then you decide for yourself. You may feel that mouthwash is fine for you, and that's fine. Next thing is you need to visit your dentist regularly. Regular checkups and cleaning are essential for detecting potential problems early and keeping your teeth and your gums healthy. The next thing that's vital is to eat a balanced diet. You want to limit sugary and also acidic foods, as they can erode tooth enamel and lead to cavities. So you want to incorporate plenty of, and this is a no-brainer, it goes for all aspects of health, right? If I'm talking brain health, heart health, gut health, now I'm talking mouth health, again, it's incorporating plenty of fruits and vegetables, calcium-rich foods for strong teeth and gums. It doesn't have to be dairy. It could be dark leafy greens. They're loaded with calcium as well. You want to be sure that you're limiting sugary foods. You need to stay away from them as much as you can. So let's just break it all down for you. Regular dental hygiene is not just about keeping your smile bright. It's about safeguarding your overall health, boosting your confidence, and setting a great example for others. By making dental care a priority in our daily routine, we can enjoy the benefits of a healthy mouth and a healthy life, right? And that's what this podcast is all about. It's talking to you about very simple ways to stay healthy, to stay vibrant, to stay strong as we're aging and for many years to come, because we want to be enjoying our lives. I don't think that any of us want to grow older and stay alive longer if we are battling all kinds of health conditions. So as simple as taking care of your oral hygiene, you can be preventing heart disease from brewing. And once you have heart disease, you have heart disease, right? And who wants that? We want to be healthy. We want to be vibrant. That's the purpose of my podcast, is to provide all the ways that we can continue to enjoy life as we grow older. Thank you for listening. I appreciate each and every one of you. I hope that this episode has inspired you to take better care of your teeth and your gums, and your future self will thank you. And I thank you for listening. And if you think that this episode can benefit anyone who you know and love, please share it out with them. Also, if you're not currently subscribed, please subscribe so that you will be notified the next time that I drop an episode, which is every Tuesday morning at 9 a.m. Again, thank you for listening. If you would like to schedule a free 30-minute health assessment with me, you could go to my website, www.susanlopresti.com. From there, you have access to my blog. You could learn more about me. You could schedule a free 30-minute health assessment. You're under no obligation to continue, but we could just chit-chat for a little while and see if I could offer you any kind of advice or give you some tools to improve your health. Thank you again. I appreciate each and every one of you. Until the next time, be well, stay happy, and bye for now. Take good care, everyone.